Hello, I'm Amy Southerton, Assistant Director at the Center for the Study of Canada and Institute on Quebec Studies at State University of New York College at Plattsburgh. I'm delighted to welcome you to the second session of the virtual Conversations on Canada series. The Conversations on Canada series is organized by the Center for the Study of Canada and Institute on Quebec Studies at SUNY Plattsburgh, a U.S. Department of Education Title VI National Resource Center on Canada, with additional support from the Quebec Ministry of International Relations and La Francophonie. Developed in response to the COVID-19 pandemic, the Conversations on Canada series addresses current issues central to a fuller understanding of Canadian society. Thank you for joining us today, and most importantly, we hope you are doing well. We are excited to welcome our audience members from both the United States and Canada, and especially appreciate participation from SUNY Plattsburgh students, faculty, and staff, business people of our New York State North Country region, as well as scholarly members of the Association for Canadian Studies in the United States. We appreciate everyone's interest in this webinar and look forward to an engaging time together. While we are in a virtual webinar environment, in terms of housekeeping, we welcome you to utilize the chat with any comments you'd like to share. If you have any questions you would like to submit, please note the Q&A box on your screen. Again, we ask that questions you have be submitted specifically in the Q&A box. At this time, it's my pleasure to introduce you to Dr. Christopher Kirkey, Director of the Center for the Study of Canada and Institute on Quebec Studies at the State University of New York College at Plattsburgh, and President of the Association for Canadian Studies in the United States, who is moderating this session. It's also a pleasure to welcome Mr. Picard, reporter and columnist of the Globe and Mail, who will present the pandemic experience. How do Canada and the US compare?
Moderate the question and answer session afterwards, and we certainly welcome your questions. So with no further ado, from the wonderful virtual world of Montreal, my good friend and colleague, Picard. Andre, please.
Thanks, Christopher, and thank you, Amy. Thanks for the kind introduction. And the only thing that would be better would be visiting you in person, but we're going to make good use of this virtual world, I hope. So the short time I have today, and I want to be brief so we have lots of time for questions, I want to talk about this issue that's monopolized our lives for the past 7 or 8 months, the coronavirus pandemic. And as you heard, I want to speak particularly, examine how the Canadian and the US responses differ. So let me start with a little bit of global context. And I don't know, I don't see the slides. Do you see them, Amy? Okay. I'm very much a Luddite, so I struggled with having slides, but they're going to be very basic, but I do have some slides. Nice fancy flags to begin with. Now, I want to start a little bit with some global context. So worldwide, there are about, the last I checked this morning, 38 million coronavirus cases around the world and about 1.1 million deaths. More than half of the cases and half of the deaths are concentrated in 4 countries, 4 big countries: the US, India, Brazil, and Russia. Now, the US, as people know, has the dubious distinction of being the world leader in cases, more than 8 million cases, and more than 220,000 deaths to date. Now, Canada, by comparison, has 185,000 cases, and we're creeping up on almost reached 10,000 deaths. And we have this little map. As you see, the cases are not evenly distributed around the country. Canada's outbreak is very much centered in the 2 populous provinces, Quebec, where I am, and in Ontario, and then a little bit around the rest of the country, but very much concentrated politically and pandemic-wise in those 2 big provinces. So that tells us where the world is, where the US is, where Canada is. Let's look a little bit at how the Canada and US numbers compare. And you'll forgive, I'm going to have a bunch of slides with numbers. I'm very much of a data geek. Over the last 8 months, I've spent my days staring at data and graphs like this, trying to figure out what's happened and what, more importantly, what's going to happen. And when we look at graphs, we get a good sense where things are going. And as you see from this slide, things are not going to a very good place. They're going up, up, up. Now, Canada is going up as well, but because it's on the US scale is so much bigger, it looks like we're flat, but we're not. And you'll see that in a moment. Both countries are, their outbreaks are rising. An interesting thing is our outbreaks have very much gone in parallel. There's not much difference in Canada and the US at the beginning. We saw our first cases in January and February, just days apart in January. Our first deaths in early March, both countries. And that's when things really took off. So in March, the virus started spreading in our communities. So within New York City, within Montreal, and that's when the world changed and when our world's changed, I think, probably forever. Now, what does this graph tell us? This graph tells us essentially that the US has a lot more cases than Canada, not only in absolute numbers, but proportionally. Proportionally, the US has about 5 times as much coronavirus as Canada, which is quite stunning given our geographical proximity. So about 24,000 cases per million in the US, 4,800 in Canada. Big difference. The US also has many more deaths than Canada. We hear a lot about the death rate is low, it's falling. That's true, but the US death rate is very, very high. About 663 per million compared to 254 per million in Canada. Now, as I mentioned, both countries' epidemic curves followed a pretty similar pattern in the early days, from March until July, and then things changed fairly appreciably. Canada took public health measures, I think, a lot more seriously than the US in the spring, and we saw a payoff in the summer. In the summer, our numbers dipped to just a couple of hundred cases a day. Now we're up to about 2,000 cases a day, so we're tenfold lower a couple of months ago. The US never saw a big dip like that. It's had some small waves here and there, but its curve has gone steadily upwards. And now we're back to a point where both countries' epidemic curve is rising, and they're both rising fairly rapidly. It's not, things are not going too well in the fall. In this graph you see here, you see that little dip in July and August that Canada had, and now we've jumped back up. And we know that winter is coming. We know that we're going to spend more time indoors, and there's a lot of fear in the northern climates like Canada, northern New York, about what's going to happen in the fall. The flu is coming. We're going to be spending time indoors where the virus loves to spread, where it spreads much more readily indoors than out. So there's, I think, a real fear of what we're calling the twindemic, the flu and the coronavirus joining forces and the death rate going up quite considerably. Now, again, this is speculation. We don't know. There's some good news. If we look to the Southern Hemisphere, to Australia, who normally has their flu season before us, they had virtually no flu when they had COVID. So all these measures that we take to protect ourselves from COVID also protect us from the flu. So this could be a partial good news story, but time will tell. Now, the final graph I wanted to show is this one in my orgy of numbers, and it's the one showing how we're doing internationally. If you see, the yellow line on top, the US, the blue in the middle is Canada. Canada's the middle of the pack. The US is the top of the world, but overall, both countries are doing quite poorly compared to those 200 other countries you see on the graph. We're both very close to the top. So nothing to be proud of internationally for either of our countries. Now, as I mentioned before, the US has the world's 3rd largest population, but it has the most cases and deaths. Canada has the world's 39th population, and we rank 26th in the world in coronavirus cases. So again, we're both batting above our weight in terms of infections, and that's not a good thing, but it demonstrates that we've struggled. All of North America has struggled, Mexico as well. And this despite the fact that we both have, I think, superb medical infrastructure and pretty good public health infrastructure. Not that we've used it well, but we have the ability I think, to rein this in a lot better than we did. So that satisfied my need for data geekism, I hope, for now. So I want to turn to, I hope, the more interesting part, more substantial part of the conversation beyond the numbers is the why. Why did this happen? Why did we both respond slowly, respond poorly to the biggest pandemic in a century? And why did the US do markedly worse than Canada, and worse than any other country in the world for that matter? And I think these are important questions. And I think the short answer is very much a question of political leadership, or lack of political leadership. So we have very different leaders in Canada. I think you know the guy on the left, Donald Trump, and Justin Trudeau, our mask-wearing prime minister on the right. Interestingly, both of them have been infected with coronavirus. Our prime minister got it over with early in March, and the US president is, as far as we know, still infectious. Now, I was struggling as I was preparing these notes to find the words to describe how badly the Trump administration has done. And I think there are no words for it, how poor the response has been, the foot dragging. Probably the worst of all is the denialism, denying that this is serious, that it's a problem. And it's reflected in all the data that you saw and more. I was looking at data yesterday of state by state, and you know, the states with the worst problems are the red states, the Republican states, because people are just not responding. So this is very much a political pandemic in the US, I think, more than anywhere else in the world. And that's, I think, the single biggest difference between Canada and the US, is here the pandemic hasn't really been politicized. In fact, I think it's been depoliticized to an amazing degree. All our governments, and in Canada we have a mixture of provincial governments that are conservative, liberal, New Democrats, all of them have exactly the same response with very, very few differences. And that's, I think, quite astonishing. Even the staunchest conservatives in Canada, nothing approaches what is happening in the US in terms of denialism and not wearing masks, etc. In Canada, not only have there not been partisan attacks, it's a very partisan question in the US, but I think in Canada there's been really unprecedented cooperation between our governments, federal and provincial governments. So you see here Justin Trudeau with the Premier of Ontario, Doug Ford. They're different. One's a conservative, one's a liberal. They're getting along famously during this pandemic. It's incredible, to the point where the conservative Premier is not even endorsing the conservative leader federally. That's how well things are going. On the right, you see Premier Legault in Quebec, also very much at odds with the federal government, but really see eye to eye on their pandemic response. Now, if you look at these photos of our prime minister and our premiers in the big provinces, try and imagine a photo here of Donald Trump and Andrew Cuomo. And I don't have a slide of that because I couldn't find one. I'm pretty sure they don't see eye to eye on anything, and certainly not anything related to the pandemic. So it is a really interesting issue, that partisanship. There are a lot of political attacks in the US, and I don't think Canadians would actually really tolerate the kind of attacks you see there, the partisan attacks. If our prime minister did like Trump and attacked a premier, a governor, I think it would be their death knell. And I think, again, that says a lot about Canadians and their wanting this to be dealt with as a health issue and not a political issue. The other big difference between the countries is our public health leadership and the power that it's been given specifically. Now, for the most part, Canadian politicians have deferred entirely to public health officials. So you see on the left, Anthony Fauci of the US, on the right, Theresa Tam of Canada. Theresa Tam does a live broadcast on TV every day, gives an update, and that's the gospel of the day. The Prime Minister comes after her, and he speaks about economic issues, but he doesn't really speak about health issues, unless it's to reinforce what the chief, our CPHO, we call her, the Chief Public Health Officer of Canada does. In the US, by contrast, Dr. Fauci and others, I think are constantly ignored, and they're overruled and sometimes even abused, is not too big a word to use. Now, the face of the pandemic in Canada is very much the face of Dr. Bonnie Henry. I don't know if any of you have heard of her or all of you have heard of her. I hope so. She's the Chief Public Health Officer of British Columbia. So she oversees public health in a small province, but again, she's become this public icon for her cool and level-headed responses, for her ability to communicate and to get people on board. So the New York Times called Bonnie Henry one of the most effective public health officials in the world. I don't think that's an exaggeration. They said she serves as an inspiration and a model for nations struggling to emerge from lockdown. So you see, we have posters of her: be kind, be calm, be safe is her mantra that Canadians all know by heart. And she's become popular in weird ways. She loves to wear, she loves shoes. So she talked about that one day in passing, that she loves her shoe collection. So a shoe was designed in her honor by a famous designer, Jason Fuggold. And she even has an octopus named after her. So I guess that's the ultimate compliment. I'm not sure. I think it also tells us something important, though. It tells us that Canadians really respect institutions and they respect public servants. And you can say many things about the US, but I don't think you can say they respect their institutions too much. So again, a big difference. Now, I don't want to leave the impression that everything is rosy in Canada, because it's not. As I said, we do very, very much poorly compared to Asian countries, many European countries. So we can't be too proud, but one of the favorite sports in Canada is to compare ourselves to the US, because it always makes us feel better. So hope you don't take that too badly, but it makes us feel better. That's what we were giving thanks for on Thanksgiving. Canadian Thanksgiving was yesterday, and we were giving thanks that the US can always make us look good. But where do we look really bad? Where Canada failed monumentally was in one area in particular, and that's elder care. So in Canada, more than 80% of our deaths have been in institutions. So in long-term care facilities, nursing homes, and retirement homes. We've had 9,600 deaths in Canada, and 7,500 of those have been in these institutions, which is quite remarkable. There's been very little death in the community, which is a contrast to much of the world. The only other country, interestingly enough, that has that kind of death rate in its institutions is Sweden. And Sweden actually made a decision. They said they weren't going to send older people who got infected to hospital. They essentially just let them die. Canada didn't do it deliberately, but it did it in practice. So that's going to be a big issue in Canada. There's really going to be a reckoning in Canada when this is over about fixing our elder care system. Personally, I'm just finishing writing a book about elder care and how it needs to be fixed, but that's going to be the big political issue in Canada post-COVID for sure. Now, I should mention too that the US didn't do particularly well with its elders. About 80,000 of your 220,000 deaths have been in nursing homes. And that number is that's about 40% as it compared to 80 in Canada. And it's probably an underestimate because there are different rules for reporting deaths in different states. So many of them actually don't report the deaths. But the reason it's 40% and not 80 is because there are just far more deaths in the community in the US. Now, the other interesting thing about long-term care, and this has gotten a lot of discussion, it's something I write about in Canada, is that it's not part of our Medicare system. So Canadians love their Medicare, but that consists of hospitals and physician care. Our long-term care system has a different history. It came up through the penal system, was part of our jail system, and it gets funded in a different way. So that the fact it's not part of Medicare really rankles Canadians. We have a lot of private provision of care and some publicly subsidized care, but I think, and very little effective regulation. So there's really a move afoot to bring elder care into Medicare, and that'll be an interesting discussion going ahead. Now, aside from politicians, I think the monumental difference between Canada and the US is cultural. I think it's no surprise that we have cultural differences. Not only do we have a different day for Thanksgiving, we had our Thanksgiving yesterday, and yes, I consumed an excessive amount of turkey. We do have that in common. And we do normally watch football, although Canadian football, unlike American football, has been canceled for the season. Another example of how we take COVID a little more seriously. But we have very different cultural norms. I think Canadians are far less individualistic than Americans, and that's played out in this pandemic. We believe in making individual sacrifices for the good of the collectivity. We're not exactly communists, but a little sacrifice a little bit of our individualism for the greater good. That's seen as normal, and I think again we've seen that reflected in the COVID response. And it's been like, the other real cultural reality is that Canadians are rule followers. We really, when we do what we're told. We're law-abiding and then some. So there's a common, you probably know if you're all Canadiophiles, but you've probably heard the Canadian joke, which is, how do you get Canadians out of the pool? And the answer is, you say, please get out of the pool. So we very much love to obey our rules, no matter, you don't have to smack us on the head too much. We have mask rules. There's very few fines. Enforcement has been almost non-existent because it's quite voluntary, almost universal. Physical distancing rules were embraced in Canada fairly early on. Here's a park in downtown Toronto where they drew circles on the grass so people would know where to physically distance. On the right is a beach in Florida at the same weekend. So a little difference. You can see some cultural difference there. Indoor mask wearing, as I mentioned, is almost universal. And that's true even in parts of the country where there's very few cases, which is really interesting. In our Atlantic provinces where there's a handful of cases a week, people go into stores wearing masks. So again, very different from the US. I put a picture of a mask protest there. And Canada has had some anti-mask protests, but very much fringe elements. I live in Montreal, where is the centerpiece of the anti-mask movement in Canada, and that consists of about 100 people who like to march on the weekend. And interestingly enough, the leader of the group is the Raelians. The Raelians are a cult, a Quebec-based cult that believes in UFOs. So that gives you a sense of where anti-mask movement is on the Canadian spectrum. It's very much the fringe, and I'd say in the US it's very much more on the mainstream, the political mainstream, to the right, obviously. One area where there are real similarities between our two countries has been in managing lockdown. So I think both countries have struggled mightily with how do you lock down, what do you lock down, how long do you stay locked down. And I think both countries have been very, very impatient, and that's why we've seen resurgences. And we've struggled, I think, with priorities. What is the priorities? I think Quebec is one of the few places where I've heard them say, and New York City, to be fair, also, they both said the same thing. Our priority is to keep schools open. Everything else takes a back seat. So Quebec has closed down a lot of businesses that aren't closed elsewhere. So has New York City. Any borough that has a certain number of positive cases, more than 3%, they shut down businesses. So it's interesting that we have that in common, but in very small, compact areas. I think both countries have struggled with testing, but in different ways. The US has approved all manner of tests. You can get all kinds of tests, some of dubious quality. We saw that with the White House. They used a testing method which was totally inappropriate, resulted in an outbreak as a result. And testing rates are all over the map in the US, especially a little bit in Canada. Canada was very slow to start testing. We really struggled with being ready, with having reagents for labs, et cetera. The US didn't have that because it's more of a private business model. They get things done. But both countries have among the highest rates of testing in the world, 360,000 per million in the US. 212,000 per million in Canada. Now, those numbers on the surface suggest about 1 in 3 Americans, 1 in 4 Canadians have been tested, but that's not the reality. The reality is many of the people get tested many times. So those numbers are a bit misleading. Now, the difference, of course, is in Canada, we don't pay for tests. Testing is part of our Medicare system, unlike nursing homes. So that's an issue. The vaccine, when it comes, is going to be free in Canada. I don't know how much it'll cost in the US. That'll be interesting. Now, the final thing I'll mention is the border, the Canada-US border. 2/3 of Canadians live within 100 kilometers of the border. So the US matters to us in many ways, geographically, economically, culturally, etc. Now, that border has been closed for many months. Closing the border has helped Canada keep its case count down. All our early cases, they've been tracked with genomics. All our early COVID cases came from Canadians coming back, mostly Quebecers, coming back from Florida, coming back from New York, and bringing the virus with them. So that the border has been closed since around April, early May, and it's going to remain closed for the foreseeable future. The next date is November 31st, but it'll likely go into the new year. Now, somebody asked me recently, is the border closed to keep Canadians out of the US or to keep Americans out of Canada? And I think it's actually a bit of both. As I said, more than anything, Canadian officials don't want Canadians going to south and then bringing more virus back. That's the principal reason. The reason the US has shut the border to Canada is, I'm not sure, but probably retaliation. That's more of an American thing. And don't forget, though, that the border is open to trade, and that's very important. We're the #1 trading partners with each other in the world, and goods and services have flowed quite freely. So there are thousands and thousands of trucks and planes across the border each day in Canada and the US. So that has kept our economies rolling. So it's a semi-closed border. So I want to leave, as I said, a lot of time for questions. So just a final word. I think there's no question that Canada's response to the pandemic has been a little better than the US. I think we can pat ourselves on the back, but very gently. We shouldn't go overboard on the differences. But again, the US response has been shambolic. It's been horrible in every way. I think it was described recently as a dumpster fire, and I think that's fair. I can't imagine a health response to anything in the world being worse than what's happened in the US. Here's a little symbolic picture of what's going on down there. I don't know if that'll change after the election in November. Now, Canada, on the other hand, has its problems. Canada has been overly cautious. We've been very slow to act. We've been hesitant, always dipping our toe in the water rather than acting firmly and quickly. So that's our problem. Canadians are wishy-washy. And that's not a lot better than what's happening in the US. So as a result, I think we've both paid a very heavy price. Hopefully we can learn from each other's mistakes. And as the pandemic drags on, I think we have to realize it's only going to get more difficult. It's going to get more difficult for freedom-loving Americans who don't want rules, and it's going to be more difficult for mostly compliant Canadians who are going to be less compliant because they're getting fed up. So I think I'll stop there and look forward to, Christopher, whatever questions and comments come my way.
Thank you, Andre. It's a wonderful presentation in providing those comparative bases. I appreciate it very much. We all do. And as you would suspect with a topic as urgent and daily as the COVID-19 pandemic, we have a lot of inquiries from people. And I'm just going to throw these out to you one at a time. We can certainly, it's a couple minutes past 4 and we're good till roughly 4:25 or so. So we've got a good chunk of time here. In no particular order, one question that crossed our plate was, are there particular cities, provinces, or regions in Canada that you would point to as success stories, and if so, why?
Yeah, so I think there are a few. The one that springs to mind is Kingston. So Kingston, the small, well, not by Canadian standards, a mid-sized city that was once supposed to be the capital of Canada, but right on Lake Ontario. between Toronto and Ottawa, between two of our big cities. And Kingston has just a good local public health official who's been very proactive. So what made Kingston and what's made us write about Kingston a lot is, for one, the nursing homes. So I talked about all the deaths in the nursing homes. There are no deaths in nursing homes in Kingston. So what happened? What happened is the public health official in that city, and our public health officials have a lot of power under the law. He ordered all food inspectors to become long-term care inspectors. So he went in early, ordered the end of, we have 3-4 bedrooms. He ordered that those stop. He made sure that infection control measures were put in place early, et cetera. So it demonstrates that the problem we had everywhere else was preventable. He's also the public health official there, Kieran Moore is his name, has been very transparent. We have problems with transparency, data sharing in Canada. We're very small C conservative. He bucked the trend. He talked very openly. There was an outbreak early on at a nail salon. So some women went and got their nails done, spread in the community to about 50 or so people. He named the nail salon. He did really fast tracking of figuring out who got infected, and he stopped that outbreak in its tracks. So again, a real demonstration of how to act forcefully. So I think that's one of the big success stories in Canada, but there's a lot of little ones. The other one I would mention briefly is our Atlantic bubble. So we have 4 Atlantic provinces, and they've created a bubble, essentially keeping everyone out except they can travel within their bubbles. So you can travel within those 4 provinces pretty freely, and they have virtually no cases. Only in the last couple of days has the bubble, I wouldn't say it's been burst, but there's some little leaks in it. There's been some people fly in from outside the bubble who've brought coronavirus with them, and that we're going to see how bad that gets. But that's been an interesting experiment as well.
I have a very place-based question for you from a colleague of mine, Charles Deshays. He wants to ask why Quebec has so many more COVID cases than anyone else in Canada. He points out during the first wave, there was some conjecture that Quebec was somehow a victim of bad luck or due to the timing of its spring break in the province. This certainly doesn't seem to be the case for round 2. So why are there so many more cases and deaths in Quebec?
Yeah, so I think it does go back to the March break. So Quebec has an earlier March break. A lot of Quebecers go to the US. They went to Florida, they went to New York, where there was early outbreaks that people didn't know about at the time. So Quebec seeded, SEEDE, seeded the outbreak very early. And it's never really recovered from that. But to this day, it's still paying for that it's really ingrained here faster and deeper than anywhere else. So that is a big issue, the March break. So timing was an issue. The other one is the nursing homes. So we have a lot more deaths because of nursing homes. Quebec has the highest proportion of institutionalized seniors in the world. For historical reasons, again, we're often pay the price for our history, je me souviens, as we say in Quebec, but so many people, 4,000 people have died in nursing homes in Quebec. That explains the death rate. And what's changed? What changed since that massacre in the first wave? Nothing. Our nursing homes are exactly the same. The government made a lot of gestures to hire. They're going to hire 10,000 new workers in these nursing homes because they're chronically understaffed, but those workers aren't trained yet. So in the last few days, we have more than 100 outbreaks in our nursing homes again in the second wave. So again, there's a lot of people on tenterhooks wondering what's going to happen. So I think those are the main reasons. I think the third reason in Quebec is socioeconomic. It's the poorest. Montreal is the poorest city in our country. It's a big, beautiful city, but there's a lot of poverty. We know that the infection rate mirrors the SES numbers. So the lower your socioeconomic status, the greater your likelihood of being infected. And why? Because you have crap jobs. You're the bus driver, you're working in the nursing homes, you're working in retail. Those are the people getting infected. So those 3 factors are what explains Quebec. The health minister said recently it's because people don't follow the rules, or he was blaming young people for being, too loosey-goosey about the rules. But I don't think the data actually bears that out. demonstrates very little effect. It's really that history and the socioeconomics. Sorry for that long answer, but it's a passionate report.
We'll give you a chance to give us a short answer. We have an inquiry. Someone wants to know what have been the principal impacts of COVID-19 on the Canadian economy?
Well, I think like every economy around the world, it's been savaged. I think the really interesting thing, and I didn't talk about this because I'm more of a health person, but a real big difference between Canada and the US is our governments have spent like drunken sailors. And I'm not saying that negatively, but we've really spent a lot. So about $500 billion has been spent in COVID relief to date, about $500 billion. So that's an astonishing amount of money for a small country. We're going to be in debt for a long time, but I think that's helped people follow the rules. We have something called CERB, a benefit almost like unemployment insurance for people who couldn't work because of the pandemic. It's something the U.S. is fighting about, you know, paying a small amount, but Canada gave people $2,000 a month if they couldn't work. And hundreds of thousands of people got that benefit. And I think that's actually been one of the biggest, most important health responses has been allowing people, nobody's gone hungry in Canada, no one's suffering unduly because of this economically. And I think that's interesting, but we're going to pay for it for years to come. And it'll be interesting how it bears out.
Sure. A good friend and colleague of the Center's, Professor Bob Timko, wanted to ask if you can offer a comment or two about the public health ethics framework in Canada, and if it helps us understand the different responses in Canada versus the US.
Yeah, I don't know that there's a specific ethics framework that's different. I think what's different is the more what I talked about before, the respect that public health officials have. So they have power, they have incredible power in our legislation, and they've been allowed to use it. So they haven't been usurped or overridden by politicians, especially in British Columbia. Now, I talked about Bonnie Henry. Literally, the premier of that province stands behind her, and it's done there for figurative reasons. But to demonstrate this is who the boss is. I'm taking my marching orders from her. Whatever she says, that's what I do. On the health side, the economic side, she leaves that to him. But I think that's the big difference, is practically more than ethically. You know, the ethical issue about how much do we lock down versus how much do we, you know, how much are people suffering because of the lockdown versus the virus? Our public health officials haven't really gotten into that the way it's happening in Europe and stuff. Canada, for better or worse, is very much, the party line is, you know, health trumps everything, and we're going to suffer through the lockdowns. Now, I don't know how long that will last, but that's the party line for now across the board.
Okay, thank you. We have yet another inquiry, and this is, you know, the whole notion of pharmaceutical companies developing a vaccine and ultimately disseminating vaccinations to the general population. Someone wants to know, or has inquired, where does Canada stand versus the United States on this issue? Because in terms of sort of disclosure and a sense of timing and a sense of where respective pharmaceutical companies are, we don't have a real good sense of that here in the United States. So what's going on in Canada, and is it better than here?
Well, Canada is essentially a branch plant, right? So we have pharmaceutical companies, but they're just largely, almost exclusively offshoots of larger American or European countries. So what Canada, like most Western countries, has done, including the US, is signed these deals where they're going to purchase vaccines. So we signed deals with, say, Pfizer. We're going to buy 100 million doses of your vaccine if your vaccine is successful. The US has done the same thing. Now the question is, who's going to get dibs, right? Who's going to get the first vaccines? And it'll probably be wealthy countries like the US, because that's where they're manufactured. I'm sure that the U.S. is very protectionist. It'll probably sign legislation that doesn't allow large-scale exports, so they can keep it to themselves. So there's going to be some really big ethical issues coming with vaccines. The UN has proposed that there be a single market, and that the UN distributes vaccine around the world fairly. That's a really nice idea in principle. It's never going to happen. It's a non-starter, I think, for the U.S. So what's happening is everyone's just jockeying for position to see, how many vaccines can we get. The reality is we'll probably have a vaccine or 2 or 3, hopefully, in 2021. But the data I've seen is that minimum it's going to take us 4 years to vaccinate people who need to be vaccinated. So this is not a silver bullet coming quickly. It's going to take time. So I think the big ethical issue is who's going to get the vaccine and who's going to get it in their arms first. And that's going to be there's going to be big societal debates. And in Canada, we know who it's going to be because we've had this experience before. It's going to be healthcare workers, and it's going to be Indigenous peoples. It's going to be the people who are most at risk. It's going to be people in nursing homes, and that's going to rankle some people. And I don't know if the U.S. will have that same political philosophy. And I don't think it will. It's more whoever can afford it will get it.
So Andre, when you suggest upwards of 4 years, are you talking sort of the international community writ large at that stage?
Yeah. So as they get it in everybody's arms, we're looking at 4 years.
Okay. We have a question from my colleague, Dr. Bob Ackland, who's been following the production and distribution of medical equipment related to the pandemic. And he'd like to know if you can say something about the provision of PPE in Canada.
Yeah, so Canada had a big, I'll say small S scandal about PPE early on. We were very much short of PPE, and there's a history. I didn't talk about it, but Canada had a big problem with SARS 15 years ago. We had the second worst SARS outbreak in the world after China. So SARS was a big deal in Canada. It led to the revamping of our public health system, infrastructure, etc. We purchased huge stockpiles of PPE because it was in ventilators, because all those things were short during SARS. 44 people died during SARS. It seems not much compared to COVID, but it was a big deal at the time. So we bought these millions of PPE masks, protective equipment, including masks. And what happened in the interim is they rotted. They didn't update. So SARS came along, and all of a sudden our masks that were supposed to help everyone were thrown in the garbage. So that was early on a big political scandal. And it is still to this day. We have to correct that, having the stockpiles, et cetera. It has to be monitored and kept up to date. I think we learned a lesson on that, but we still, and again, I talked about the nursing homes. The nursing homes were at the bottom of the list for getting PPE. We really protected our hospitals. Hospitals run the show in Canada. They dominate healthcare. SARS was a hospital-based outbreak, so we really buttressed the hospitals when coronavirus came along, and we kind of forgot about our nursing homes. So they didn't get PPE. And again, that's why we saw the death rate. So I'd say that's an area where we really botched things terribly. Ventilators too. Thankfully, ventilators proved to be not that useful. We thought that we needed them in large numbers early on. It turns out that putting people on ventilators killed a lot of them. So there's very little use of ventilators now with COVID. So sure. That one worked out for us, even though it was a mistake.
Thanks, Andre. Can I ask you to comment? We have an inquiry asking if part of the explanation for why Canada is doing comparatively better in dealing with the COVID pandemic has to be with the fact that, given Canada's sheer territory, that the density of its population is nowhere near as high as it would be, say, in the United States.
Yeah, we do have the benefit of geography, and I think that's why it's not a surprise that it's concentrated where we have population. So it's concentrated in our two biggest cities, Montreal and Toronto. So that's not a surprise. So I think that's part of the reason. But Toronto is the 5th largest city in North America. Toronto, Vancouver are as dense as almost any big U.S. city, save New York or Chicago maybe. So the density problem is not not an overwhelming issue. Vancouver doesn't have a lot of, Vancouver is the densest city in Canada by far. It has virtually very little COVID. So it's something more than geography. I think it has to do more with culture, with politics, with response. But sure, geography is what's protected. You know, that's why we have an Atlantic bubble. That's why the whole vast west of the country doesn't have a lot. And the north, there's really no COVID in the north because there's, you know, you can shoot a cannon and not hit anyone for 1,000 miles up there. So, sure. But yeah, geography is a factor, but not the sole explanation.
I think every epidemiologist and medical professional would agree with that. We have here a very interesting observation from one of our participants today in our conversations on Canada, and they point out that in the course of your remarks today that you had mentioned that in the context of the United States that the COVID-19 outbreak had been principally focused on red states, but they point out that states like New York State, New Jersey, Michigan, and Illinois have some of the largest numbers of folks who have contracted the virus and who have died. And they point out also that none of these states happen to be a red state, so to speak. Would you care to offer a response to that?
Yeah, no, so yeah, I should clarify when I was talking about what I was looking at in the red states was currently the rates are rising in the red states. Overall, it's all over the map. There's no question New York has been one of the worst. So I don't know, I'll be honest on my ignorance, I don't know what every state is red or blue, but I know New York is. But yeah, so there's been COVID across the political spectrum, but I think what I was trying to get across is that currently, as it gets more difficult, I think as it becomes more politicized, we're seeing the rates rise faster in the states where more Republican states where people are more reluctant to wear masks, to socially distance, to close down, etc.
Sure. With regard to education, we have a question here which I find it fascinating, which is, political leaders, federal, provincial, state leaders have reportedly made the case, metropolitan leaders, Bill de Blasio in New York City, about keeping schools open being one of their principal aims. But the question is, should that really be a top priority, since a lot of new cases seemingly are coming from school systems, open schools?
Yeah, so the school issue, I think, is a really interesting one. I personally think it is really important. I think if schools are not open, the economy can't function. You know, schools, parents can't go to work if their kids are not in school, right? That's with very few exceptions. So I think schools are really crucial. I think schools have actually been a success story, an unexpected success story. So we have a lot of cases in schools, but we have very few outbreaks. So to me, that's really fascinating. Kids are bringing COVID or coronavirus into schools from the community, but it's not spreading with very few exceptions. So it's really interesting. Thousands of cases in schools, but in thousands of schools. So I think, to me, we had one of our public health officials was talking about this yesterday. They're talking about where is spread happening, and schools are at the bottom of the list. So it's, I think, an interesting. I think it is a good choice as a political priority, but to me, that doesn't matter. What matters is you actually have a priority, whatever it is, and you're clear on it, what you want to do. I think the problem with a lot of governments in Canada and the US is not clear what their priority is. One day it's open the economy, next day it's schools. You have to choose. Quebec, as I said before, I think to its credit, has said really clearly, schools are our priority and everything else is second. But it's really interesting, you know, how COVID spreads in children, how it affects them less. That's benefited us. It's allowed us to reopen schools and keep them.
Right. From your perspective in Canada, and this is looking south at the United States, one of our participants today is interested in knowing that if the numbers of positively infected individuals and deaths in the United States as a result of COVID-19 continue upward, and states have to enter into another serious phase of lockdown, if you will. They're wondering if that might could that be could that really prove to be what Jane is suggesting, a tipping point for many people here in the United States? In other words, I think earlier you mentioned that people's impatience was growing towards sort of observing rules and social distancing and mask wearing. But the question is, if we're all sort of forced to go and stay at home and work from home, or, you know, in a serious way where there's really no consumer activity and very little business open, how problematic do you see that for the U.S.?
Well, I think it's problematic for everyone. For every country is struggling with this. Every time you try and lock down, it gets more difficult, right? Because the impact on people's incomes, et cetera, gets worse each time. So in March, we were told if we really lock down tight, it's only going to last a couple of months. And we did it. New York City locked down really tight, Quebec locked down really tight, and the cases went down and we were rewarded. The economy opened up, but we probably opened up a little too soon and a little too broadly, and then it shot up again. So I think it's about finding that balance, and we're seeing that in Europe too. We saw in Spain, Italy had horrific death rates. They really got their pandemics under control, and now they're losing control again. They're up around 10, 12,000 cases a day in France, from 500 a month ago. Like it can go out of hand really quickly. So how do you lock down and deny, especially in the US where there's not much government assistance, how do you lock down and keep people at home when they can't put bread on the table? I think it becomes politically untenable.
And two final quick questions, one of which is, if you look at the average response of businesses in Canada, especially small business agricultural firms, with regard to lockdowns and restrictions, for example, not being able to operate at full capacity, what's the response, generally speaking, been in Canada to that from the business community?
I think it's the same everywhere. Nobody likes it. Nobody wants to lock down, but I think more than the US, and now this is just my sense, I don't have a poll on this, but my sense is there's a little more acceptance here of, short-term pain for long-term gain. I think that you'll hear that more from our business community. And again, the bailouts have been really broad. We've really bailed out our farming sector, small businesses, et cetera. So with the government giving a little bit of help, that's made people less angry and frustrated, but only a little bit less. The angriest people everywhere, Canada, US, Europe, is restaurants and bars, right? They feel targeted, they feel put upon, and a lot of them are not going to survive. So I think everybody feels for them, but nobody knows what the answer is. It's one thing to put kids in a classroom with their desks 6 feet apart. It's quite another to put people in a bar with loud music, talking with no masks. It's a recipe for spreading the virus. And I don't know what the alternative is, other than takeout food, which is, I think there's a lot of sort of support for let's buy our food at restaurants and let's be big tippers and stuff like that. There's that philosophy to help people out, but it's not going to turn out well for most people, unfortunately.
Okay. And can I ask you to respond to my colleague, Dr. Colleen Dooley's asked if you can speak to the prevalence and or attention paid to COVID in Canadian prisons and jails?
Yeah, so not gotten a lot of attention, just as I don't think it's gotten a lot of attention in the US. From what I've seen very little data, but we had some outbreaks early on, but I haven't seen big outbreaks in Canadian prisons the way I've seen in US prisons. And again, I think our conditions are a little different. Prison, we proportionally per capita, we have far fewer prisoners. In Canada, our jails aren't like our country, are not as crowded. So there's not the opportunity for spread. Our prisons practice harm reduction measures like, you can get needles in prison in Canada. So stuff like that, all of that makes it less likely that disease will spread, including COVID. So I think it's a concern, but I haven't seen it be a big issue. It's probably worse than we know, but it hasn't been an overwhelming issue. And the same is true with our homeless population. There's been a lot of COVID, but a lot less than people expected. Canada, a lot of Canadian cities have housed the homeless in hotels because hotels aren't operating. So again, what's going to happen? Are we going to throw people back out on the street when there's no more COVID? I think that's the most interesting thing about the pandemic is it's going to force us to rethink a lot of social policies, whether it's elder care, homelessness, basic income is a big issue in Canada. You know, we're giving people a basic income essentially to survive the pandemic. So why don't we do it permanently? So a lot of these issues are going to be with us for a long time and hopefully make our societies better. How's that for a hopeful note?
That was very good. I am going to sneak one last question in, and then I'm going to turn it back over to my colleague, Amy Sutherland. And it really emerges from your final remarks, Andre. When Canada does emerge from this, what are going to be the lasting impacts on Canadian society? What do you think some of the 2 or 3 key things that we'll see that's different about Canada, how it's remade, how Canadian society functions?
Yeah, I think debt's going to be the big one. How do we handle debt for many, many years to come? That's going to be a big one. I think we're going to remake, I think and I hope desperately that we're going to remake our whole elder care system. We're going to rethink why do we institutionalize so many of our seniors? How do we institutionalize them, et cetera? I think that's going to change. I think there's a serious discussion coming on basic income. You know, we have a multitude of social welfare programs. Canada's a social welfare state, but can we do it more efficiently by just guaranteeing a minimum income to everyone? I think that's going to be a really interesting one. The homeless question I mentioned, I think we're going to rethink. A lot of people who are homeless aren't homeless anymore because of this pandemic, because we don't want them to get infected. What do we do with them in the future? Do we treat them better permanently, hopefully? So I think some really big societal questions will come of this.
Thank you. That's fabulous. I want to personally ask everyone to join me in thanking Andre for just a wonderful presentation. Thank you, Andre. Much appreciated. Much appreciated.
Thank you.
I'm going to turn it over to my colleague Amy now to conclude today's conversation. Amy, please, if you would.
At this time, we ask for your feedback on the session via the Zoom poll being presented on your screen. Thank you, Andre and Chris, for this exciting conversation on Canada, and special thanks to our virtual audience participants and to all our supporters at SUNY Plattsburgh, the U.S. Department of Education, and the Quebec Ministry of International Relations and La Francophonie. Please do join us for the 3rd Conversations on Canada that we have next up, taking place Thursday, November 12th at 3:30 p.m. Eastern Time with Dr. Deborah Thompson, Associate Professor in Political Science at McGill University, who will speak about the Black experience in Canada, race, the state, and the persistence of social inequality. The registration link is now in the chat, and we wish everyone a wonderful rest of your day. Thank you so much.